MC, I get a chance to thank you all personally. Thank you so much. And thank you for your continued support. God bless you all. Now, to start the function, if I may ask our Medical Director, Dr. Venkatachalam, to fix the context for this today's message. And I also welcome Dr. Rafai and our CEO, Mr. Naveen. And let the session start with Dr. Venkatachalam. Introducing not only the text but also introducing the doctor to all of us. Thank you.
Words and my warm welcome to our friends from press. Also a warm welcome to our senior consultant cardiologist Dr. Rafai Sarkotali and our CEO Mr. Naveen. And despite having the hot climate outside, you all have come here, and big thanks to all of you. As you know that Apollo always wanted the care given to the patient at the level of international standard of care. So we keep introducing new technology so that the patient gets benefit. Our chairman started our hospital way back in 1983 with a mission to bring international standard of care to reach of every individual. In that journey, yet another procedure, yet another technology we have introduced for the patient benefit. This is happening first time in the world. That is more important. We have my warm welcome to Mr. Bikramchand, our patient, and his family members. Giving life to somebody who has a unique problem and he needs a unique treatment. So you have many hospitals in India, but why only Apollo can do is because of this is Apollo, because we have very skillful doctor and we have technology, we have infrastructure, and our chairman Dr. Pradap Reddy always insists that bringing the best technology to our country is very important, so that our patient need not go abroad. And not only bringing the technology, but also you need a good doctor to give that care to the patient, so that we can treat those patients here. So we have a patient with us. He had ectopic kidney. The kidney was not in a normal place. It's supposed to be there. It is in a different place. Where going and using a catheter, doing a denervation, renal denervation therapy is unique. It's a very challenging and complex procedure. Dr. Rafai, thank you, Dr. Rafai, for doing that wonderful procedure and making our patient get better. And he is with us. We are really happy to have you, sir. And as I said that, Apollo we have multi-specialities, and among the specialty, cardiology is very close to our chairman, because he himself is a cardiologist. So whatever is happening in the cardiology area, in the field of cardiology medicine, anywhere in the world, and happens in Apollo Hospital also. So we are leaders. We started the first bypass surgery in our country, and first stenting, and then we have started the first robotic cardiac surgery in our country, and the first heart transplant happened in same Chennai. So Chennai Apollo Grims Road is known for many firsts, especially in cardiology. So today is no surprise that it is first in the world in this procedure, and Dr. Rafai has done, and a big appreciation to him. Dr. Rafai is a renowned cardiologist, and he has treated so many thousands of patients, and you are a unique one among them. And he has done his cardiology training in India and then abroad also. And he was a consultant in Essex Cardiothoracic Center, UK, and also he was consultant in King's College Hospital, London. And then he came to India and then been part of Apollo, and whatever the best available in India, so he brought to India, and then he is treating many patients with such unique disease, and he's one who always wanted to do a new procedure bring the best what is available anywhere to the cardiology patients. So we have this leading young cardiologist and has made a significant difference to many patients' life, and we are happy to have Dr. Rafai with us. And I also thank Ms. Sugandhi for organizing this press conference and for our marketing department. Also, big thanks to our CEO for his encouragement and support. I'm sure that Dr. Rafai will take us through the presentation and explanation of the procedure. And the press members gathered here, definitely it will be a significant message which we can take to the public because there are many patients with this similar disease. They will have high blood pressure, can't be controlled with medications. But this procedure helps to stabilize the pressure significantly, so they don't require too much medicines and to have a regular life, because hypertension is one thing that which can affect, it's like a diabetics, which can affect the entire system. It's a systemic disease. So the complication of the hypertension can be controlled. This is one more significant way where there is, if there is an indication, it should be done, and that technology and skill is available with Apollo. And with that, I would like to invite our senior consultant cardiologist, Dr. Rafai, for his presentation. Thank you.
First of all, I would like to thank Dr. Venkatachalam for introducing me, and it's a great pleasure to be here. And I thank my patient who kindly agreed to come on to this program. So today, what we are going to do is to show you a successful completion of a world's first spiral renal denervation therapy, which is a newer therapy for uncontrolled blood pressure in a patient who is the unique combination of ectopic kidneys. So I'll just run through certain important point about hypertension. So you know that hypertension is a very prevalent disease in the world. So you can see in India, it's around 35% of the people, there are 35% of the people in India are affected by high blood pressure above the age of 30 years of age. So 30 வயசுக்கு மேல உள்ளவங்களுக்கு 1 in 3 people in India is having high blood pressure. அதுல வந்து நிறைய பேருக்கு வந்து they don't know that they have high blood pressure. So 30% of the patients don't know whether they have high blood pressure. So they are untreated blood pressure. 35% are treated and controlled. மற்ற 35% of the people are treated but uncontrolled. So they are taking medicines எடுக்கறாங்க but blood pressure is not under control. So it's around 1.1 billion population all over the world have high blood pressure. So இரத்த கொதிப்பு வந்து 1.1 billion மக்களுக்கு உலகம் ஃபுல்லா இருக்குது. So less than 20%, அதாவது 5ல ஒருத்தர் தான் blood pressure நல்ல கண்ட்ரோல்ல இருக்குது. So that is the studies which showed, ஆய்வுகள்ல வந்து எப்படி சொல்லிருக்காங்கன்னா 1 in 5 people, 5ல ஒருத்தர் தான் blood pressure சரியான சதவீதத்துல கண்ட்ரோல் ஆயிருக்கிறது. மீதி 4 peopleக்கு வந்து blood pressure is not under control. By 2025, 2025ல வந்து 1.6 billion people will have high blood pressure all over the world. Yeah, the blood pressure is very important because as Dr. Venkatachalam nicely said, as diabetes mari, blood pressure is also a very leading cause of heart attack, stroke and death. So அதாவது மாரடைப்பு, பக்கவாதம் and mortality, death, இதுக்கு எல்லாமே blood pressure ஒரு முக்கியமான காரணம். So blood pressure வந்து if you reduce your blood pressure correctly, you reduce your incidence of any heart attack by 13% and death by 20% and death by 13%. So by reducing your blood pressure, உங்களுடைய இறப்பு சதவீதத்தை வந்து 13% குறைக்கலாம் and heart attack, stroke அந்த மாதிரி 20% குறைக்கலாம். So blood pressure reduction, அதாவது இரத்த கொதிப்பை சரியான கண்ட்ரோல்ல வச்சிருந்தா இந்த இதெல்லாம் அவாய்ட் பண்ணலாம். So இதுதான் இந்த ஸ்டடீஸ்ல சொல்லிருக்காங்க. ரிலேட்டிவ் ரிஸ்க் ரிடக்ஷன் 25% ஸ்ட்ரோக்கை குறைக்கும். அதாவது பக்கவாதங்கள் வர்றதுக்கும் blood pressure வந்து முக்கியமான காரணம். So அந்த blood pressure கண்ட்ரோல் பண்ண முடியாத பட்சத்துல, so if some patients வந்து 2 மருந்துகள் 3 மருந்துகளே blood pressure நல்ல கண்ட்ரோல் ஆயிடும். சில பேஷண்ட்ஸ்க்கு வந்து 5 மருந்துகள் சாப்பிடும்போது blood pressure கண்ட்ரோல் ஆகாது. அதுபோக அவங்களுடைய லைஃப் ஸ்டைல் சேஞ்சஸ், அவங்களுடைய உணவு பழக்க வழக்கங்கள், அவங்களுடைய எக்ஸசைஸ் கெப்பாசிட்டி, அவங்களுடைய சால்ட் இன்டேக், அதாவது உப்பு சதவீதத்தை குறைக்கிறது, இது எல்லாமே blood pressure யூஸ்ஃபுல். பட் இது எல்லாமே பண்ணா கூட சில பேஷண்ட்ஸ்க்கு வந்து we know that 25% of the peopleக்கு வந்து blood pressure குறைகிறது இல்ல. சோ அந்த மாதிரி குறையாம இருக்க பேஷண்ட்ஸ்க்கு இந்த மாதிரி ஹார்ட் அட்டாக், ஸ்ட்ரோக், இந்த உயிரிழப்புகள்லாம் வரலாம். அதுக்கு தான் இப்ப நியூவர் தெரப்பி அப்படின்னு வந்திருக்குதா, ரீனல் டினர்வேஷன் அப்படிங்கிறது. மேலை நாடுகள்ல பண்ண ஆய்வுகள்ல வந்து ரீனல் டினர்வேஷன் தெரப்பில வந்து 20ல இருந்து 30% blood pressure குறைக்க வாய்ப்பு இருக்கு அப்படின்னு சொல்றதுதான் இந்த ரீனல் டினர்வேஷன்ங்கிற ஒரு ப்ரொசீஜர். அதுல தான் அந்த கார்ட்டூன் இருக்குது, நீங்க பார்க்கலாம். அது வந்து இது கிட்னிக்கு போற அதாவது சிறுநீரகத்துக்கு போற ரத்த குழாயில இந்த மாதிரி ஒரு சின்ன ஒரு டியூப் உள்ள பாஸ் பண்ணி we will give ablation radio frequency ablations அப்படினு சொல்லுவோம். இது வந்து இதயத்திலேயே முன்னாடி கொடுத்திருக்கோம் வேற காரணங்களுக்காக. பட் இந்த blood pressureக்கு மெயின் காரணம் sympathetic nerves, அதாவது பிரெயினுக்கும் கிட்னிக்கும் கனெக்ட் ஆகிற sympathetic nerves ஓவர் ஆக்ஷன் இருக்கும்போது blood pressure is very high. அந்த மாதிரி சூழ்நிலைகள்ல இந்த நர்வை வந்து கொஞ்சம் கிளியர் பண்ணி விட்டோம்னா அந்த கிட்னி ரத்த குழாயை சுத்தி உள்ளத blood pressure குறையுங்கிறது ஆய்வுல சொல்லியிருக்கு. ஸோ இந்த மாதிரி ஒரு டியூப் உள்ள பாஸ் பண்ணிட்டு இது கொஞ்சம் ஸ்கில்ஃபுல் ப்ரொசீஜர். பிகாஸ் இந்த கிட்னியுடைய ரத்த குழாய்கள் வந்து மல்டிபிள் ரத்த குழாய்கள் இருக்கும், சில சுருண்டு இருக்கும். அது எல்லாமே கரெக்டா நம்ம அந்த கேத்தீட்டர்ங்கிற சின்ன டியூபை உள்ள கொண்டு போய் வச்சு நம்ம வந்து பண்ணும்போது அதனுடைய எஃபெக்ட் தெரியும். ஸோ நம்ம பேஷண்ட் வந்து will coming to our patient is a 58-year-old gentleman. He had high blood pressure for more than 10 years, diabetes for few years. Last few years our blood pressure is not well under control. He was on 3 different medicines for blood pressure and it was high around 170-100. Unfortunately last October he had a heart attack. So one of the problems of blood pressure is heart attack. So he came to us as an emergency. நாங்க emergency Apollo hospitalக்கு வந்திருந்தாங்க. உடனே emergency angiogram எடுத்துட்டு அப்பமே angioplasty பண்ணி சரியான மருத்துவம் கொடுத்து ஸ்டென்ஸ் கொடுத்து நல்லா ஆயிட்டாங்க. அக்டோபர் மாசம் இது 2023ல நடந்தது. He was much better and he went home and regular follow up ல இருந்தாரு OP-ல. So despite his multiple follow-up, blood pressure over the door நாங்க செக் பண்ணும்போது it remains high and his wife is very good. She checks the blood pressure at home and she contacts me as well blood pressure. 5 different varieties of medicines கொடுத்தாலும் அவருடைய blood pressure is not well under control. அது போக அவருக்கு வந்து கொலஸ்ட்ராலுக்கு சுகருக்கு அப்புறம் ஸ்டென்ட்டுக்குள்ள மருந்துகள்லாம் சாப்பிட்டுட்டு தான் இருந்தாங்க. ஆனா மார்ச் மாசம் நான் அவரை பார்க்கும்போது பிபி வந்து 190-100 despite 5 different medications. And at that time I decided we need to discuss about the option of renal denervation therapy. So அது விஷயமா அவங்களுக்கு டிஸ்கஸ் பண்ணேன். They also had multiple thoughts, multiple consultsலாம் பண்ணிட்டு then finally they agreed for it. So in fact before this procedure we did the first renal denervation in Tamil Nadu back in September 23 ல ஒரு பேஷண்ட்க்கு நாங்க first renal denervation therapy இங்க பண்ணோம் தமிழ்நாட்டுல அப்போலோ ஹாஸ்பிடல்ல பண்ணோம். She is a 73-year-old lady. அவங்க she is doing extremely well. now இப்போ 6 மாதங்கள் ஆயிட்டு அவங்க பண்ணி she is doing extremely well. அதெல்லாம் அவங்களுக்கு காட்டினேன் அவங்க blood pressure எவ்வளவு குறைஞ்சிருக்கு, எப்படி அவங்க பெட்டரா ஃபீல் பண்றாங்கன்னு. சோ அதனால நாங்க வந்து we decided we will they also agreed for it. So this is our second procedure in Apollo for renal denervation. இவருடைய procedure is slightly unique அப்படினா மிஸ்டர் விக்ரம் சந்துக்கு it's a local anesthetic procedure தான். it's not a general anesthesia. சின்ன ஒரு மயக்க மருந்துலாம் கிடையாது, ஸ்லைட்டா ஒரு sedation அவ்வளவுதான். இது பின் ஹோல் procedure. கால்ல உள்ள மேல உள்ள இரத்த குழாயில ஒரு சின்ன பின் procedure மாதிரி பண்றதுதான். அதுல ஒரு டியூப்ல வந்து இதே கிட்னிக்கு போற இரத்த குழாய் renal artery சொல்லக்கூடிய கிட்னிக்கு போற இரத்த குழாயில we will take a catheter as a tiny tube and நார்மலா பாத்தீங்கன்னா ஒரு பிக்சர் காட்டிறேன் உங்களுக்கு. இப்படிதான் நார்மலா இருக்கும் லெஃப்ட்ல இருக்கிறது. ஒரு கிட்னி ரைட் சைடுல இருக்கும், ஒரு கிட்னி லெஃப்ட் சைடுல இருக்கும். பட் இவருக்கு எப்படி இருந்ததுன்னா ரைட் சைடுல நார்மல் கிட்னி, ஆனா லெஃப்ட் சைடுல அவர் கிட்னியே இல்ல. அந்த கிட்னி வந்து ரைட் சைடுல கீழே அந்த பழைய ஓல்டு கிட்னி கீழே சாரி நார்மல் கிட்னி கீழே இன்னொரு 2வது கிட்னி கீழே இருந்தது. இது வந்து ஒரு யூனிக் திங். இது வந்து 1 in 3000 1 in 4000 பீப்புளுக்கு தான் இந்த மாதிரிலாம் வரலாம். பட் இதுல ரீனல் டினர்வேஷன் பண்றதா இது யூனிக். ஏன்னா இதுல ஒரு சேலஞ்சிங்கா இருக்கும். நம்ம டியூப் எல்லாம் பாத்தீங்கன்னா மேல போற ரத்த குழாயில தான் ஈஸியா போய் உட்காரும். இது வந்து எக்ஸ்ட்ரீம்லி கொஞ்சம் டார்ச்சுவஸ் சொல்லுவோம், சுத்தி உள்ள ரத்த குழாய். இதுக்கு போற டியூபுக்கு வந்து கொஞ்சம் யூனிக்கா. So it's a rare anomaly where the left kidney is on the right side, well below the original right kidney. So this is what the uniqueness of this procedure. So this is the procedure we did. So if you can see, இதுதான் நாங்க டை இன்ஜெக்ட் பண்ணும்போது இதுதான் மெயின் ரத்த குழாய், ரைட் சைடு ரத்த குழாய். அவங்களுக்குள்ள 2வது கிட்னிக்குள்ள ரத்த குழாய் ரொம்ப கீழே இங்க தள்ளி இருக்குது. So this is very lower down. So to access this we need some special expertise. So இதுதான் நாங்க மார்க் பண்ணி காட்டியிருக்கோம். This is the normal renal artery and this is the ectopic renal artery well below the right renal artery. So the catheters are not designed for it. அந்த டியூப் எல்லாம் வந்து இதுக்காக அவங்க டிசைன் பண்ணல. அந்த கம்பெனி டிசைன் பண்ணது வந்து நார்மல் கிட்னி ரைட்டுக்கும் லெஃப்ட்டுக்கு தான் டிசைன் பண்ணிருக்காங்க. இவ்வளவு கீழே உள்ளதுக்கு அது டிசைன் பண்ணல. So it's a special expertise and special skills போய் ரீச் பண்ணணும். So that is what we did. So this is the tube and the catheter. You can see that 4 dot points. You can see these dot points. In the dot points, and the ratta kulayila vechittu naanga will give radio frequency ablation. So it takes 1 minute for the radio frequency ablations. Each artery, ella kidney ku endendha ratta kulai podho ella artery le kondu poi correct ah vekanum. These arteries can be very tortuous. Inge kuda reach pananum. So that needs a lot of expertise and skill to reach these places to do proper renal denervation. Ena correct ah pannada avanga blood pressure koreyum. Neenga avasarama pannittu vanda blood pressure may not drop. So this is what the pictures of that. This is the catheter which I shown here. This is the catheter which we outside. A small tube will go inside. We maneuver this catheter from here and reach it. So you can see this is our cath lab. It's a nice scenario. You can see a nice scenic background in our cath lab. This is the blood pressure monitoring machine, and this is what you can see the angiographic things, and you can see we can monitor this directly. So so this is what we did. So you can see this is what the renal arteries are here, and you can see the blood pressure. Inga blood pressure naanga monitor pannite irukom procedure பண்ணும்போது. This is where when the ablation happens, what happens, the temperature and eppadi high temperature increase ஆகுது, impedance எல்லாம் இதல தெரியும். So இதெல்லாம் நம்ம monitor ஒவ்வொரு spot line போயிட்டு we have to monitor each time. So this is what happened before. On the day of the procedure, when we started the procedure, his BP was 195/82. You can see that. That's the blood pressure. This is the blood pressure chart. At the end of the procedure, the procedure mudiyum bodhu avarude blood pressure is 138/69. You can see a dramatic drop in blood pressure. Blood pressure is completely came down, whereas his pulse rate all looks same, 57, 55. Oxygen levels 100% irundhathu. Pulse is 50-55 irundhathu. But blood pressure, you can see a difference. Before renal denervation, his blood pressure was 190. Ana panni mudicha under and the case mudikkum bodhu avarude blood pressure dropped very nicely to 138/69. But irundhalum avangalukku we are given 2 medicines. This is the team which we did the renal denervation therapy on that day. This is nearly a month ago. And post discharge, our next day we discharged him on the next day. He's on regular follow for the last 1 month, and they regularly keep in touch with me. There's no major issue. This is the blood pressure reading was sent by his wife very kindly. This is on day 8. No problem. What is the last BP numbers? I've asked it, and she said 130, 126, 140. So I said, and then on this is on 14th May. You can see 12th May she sent these readings 126/74, 128/74, 140, 126. Nicely controlled. So it's not from before it was 190. It's nicely controlled to 135. He's on 2 different drugs now. Rendu marundukal koduthirukkom. Ena thidirnu thirupi increase aayirakodaadungiradhukaga they are slowly giving only 2 medicines. Before that he was taking 5 to 6 different medicines. I think with that. So highlight of this case was renal denervation is a newer therapy for uncontrolled blood pressure. All over the world, there's only 20,000 cases has been done in the last 5-6 years. In India, only 25 patients have had this therapy so far. In Tamil Nadu, I think 3 or 4 patients. It reduces blood pressure by 20 to 30 millimeter mercury, and this should be done only by certified. So not everybody can do renal denervation. Certified, skilled, and expert operators where they can reach with the catheters in different in the mari anatomy change arukumbodhu pandradhu. Not everybody can do that. Can do the procedure. That should be certified by the company to make sure that you are eligible to do the renal denervation therapy. And this is the first time in the world to have used the Medtronic Simplicity catheter for RDN, renal denervation in ectopic kidneys. So all over the world they have done renal 20,000 procedures, but none of them have reported an ectopic kidney procedure where the kidney is on the other side. So this is the first time it has been happened in the world, and it's a safer procedure, very safe procedure. There's no complications, no major side effects, and it's a pinhole procedure. You're not left with any scars. There is no scar left, and there is a quicker recovery, and the patient can be discharged the next day. I think thank you so much for this. I'll just open up and ask Dr. Venkatachalam and Dr. Naveen to come onto the stage, and Mrs. Suganti to come as well, and the patients as well. If we can open the floor for any questions. So please. Come on.
Procedure therapy can it be for all patients?
Yes. So so far the studies have shown that patients who are on blood pressure, despite multiple medicines, if the BP is not under control, we can use it. But theoretically, yes, you can do for everybody. But the FDA, the US FDA, has approved only for patients who has high blood pressure, despite on multiple medicines. But in the future, this can develop to a stage that patient can come and say that I don't need to take any medicine. You do this procedure for me. But at the present time, that's not been kind of accepted, because normally when in medical practice, when we start a procedure, we start with high risk patients, and then we see them that there is good benefit out of them, then we slowly progress to normal patients. So in the future, maybe in the next 5 years down the line, the US FDA and the European Commission may approve for people who have high blood pressure who does not want to take any medicine, we can do this procedure. But at the present time, we are only doing for those patients.
You said the BP reduces immediately after the operation. During the operation itself, it reduces.
It's a very good point.
Yes.
So normally the idea is not for immediate reduction. The idea is for sustained reduction. So the studies have shown that over a period of 5 years, there is a 30 millimeter mercury reduction. So it's not within the, but I am just showing an example of what we, in our patient, what we found. But they've also noted in 60 to 70% of the patients, during the procedure, there is a significant drop. But even if they didn't drop during the procedure, you don't need to worry about it because it may take a little time to reduce it. So, but the advantage is not for immediate reduction. The advantage is for long term. So the patients can have it in a long term to reduce the number of medicines. Because one of the problem of taking long term medicines, as you know, is a side effect. Some medicines have their own side effects, so people may not want to take it. Somebody's sodium will go down when you give some diuretic type medicine. Somebody's potassium will go up when you give certain medicines. அந்த மாதிரி சமயங்கள்ல வந்து அவங்களுக்கு வேற side effects வராம இருக்கும்போது we reduce the number of medicine by doing this procedure.
The patient has got a kidney transplant. That kidney also you can use it for.
That has not been done yet and it's not been studied, but we still waiting for that. Hospital, and the next day we'll discharge the patient. So the patient will go back there. He can even tell what he did. Tell what you did. What exactly?
One day admit on second day discharge. Morning procedure the second day discharge.
Walking in the he walked out of the
Next day.
So it's not that, and then even a small pin hole won't cause any problem. They can immediately walk.
Two days he had pain, after that no pain also.
It's normal back.
Yeah, it was normal. Walking was normal.
And how many is only taking?
Now he's taking 2 medicines. Before he had 5 to 6 medicines, now he has 2 medicines. Only 1 day procedure.
It's a very simple and a safe procedure. The complication rate is extremely low. In fact, less than 0.5% kuda sollala. It's a very safe and effective pinhole procedure. That is the advantage of this procedure. Unlike certain heart procedure carries a slightly more risk, but here the risk is extremely low and is a very effective procedure.
Doctor, why only the renal artery?
The renal artery is the artery which supplies the blood to the kidneys. So this is where it supplies the blood to the kidneys. So on the renal artery suttida, there is sympathetic nervous system is well connected sympathetic nervous system. So the idea for us is to do the ablation பண்றதுனால அந்த கிட்னிக்கு போற இரத்த குழாயை சுத்தி உள்ள renal nerves and the sympathetic nerves வந்து கொஞ்சம் மைல்டா நம்ம இது பண்ணி விட்டுறோம். அவங்களுடைய கொஞ்சம் calm பண்ணி விட்டுறோம். It's essentially calming the sympathetic nerves. Sympathetic nerves is one of the main reasons why somebody's blood pressure is high. So by calming the sympathetic nerves, that have an impact on your brain and that reduces your blood pressure. And this sympathetic denervation is actually nearly a permanent thing. The studies have shown how far up to 10 years there is no rebound hypertension. But that is something some people may ask, what will happen in 10 years, it will go up or not. So far the studies have shown up to 10 years it's under the